Hi everyone, my name is Dr. Lakshmi. I'm an orthodontist and a cosmetic dentist. Welcome back to Wellness Seekers Lifestyle. Today's video is on physiology of tooth, that is on a cellular level, that I'll be explaining in depth on how the tooth is developed and what are its nerve supplies, what are its arterial supply that helps in the formation of your teeth. This video is more useful and beneficial for students who are pursuing dentistry, and also for the audiences who are keen to understand or are curious to know what are or how does the teeth actually form, what are its parts and what are its layers on a in detail level. It will be a very helpful video for them as well. So let's get started. Teeth serve multiple functions beyond just eating or chewing. It includes shaping the kinetics of phonation, breathing, maintaining a patent airway, and serving as a foundation for the vertical dimension of the face. The upper and the lower jaws, known as the maxilla and mandible respectively, contains the alveolar bone, a thick ridge of bone that forms the sockets of the teeth. Appropriate size and positioning of the jaws are critical in developing a proper bite, also known as the occlusion, and allows the subsequent chewing. An aggregation of cells called the tooth bud eventually forms a tooth. It is organized into three parts: enamel organ, dental papilla, and dental follicle. The enamel organ comprises of four layers: the inner and the outer enamel epithelium, the stratum intermedium, and the stellate reticulum. The enamel is made before a tooth erupts into the mouth by the enamel organ, which contains the cells called ameloblasts. These cells die once the tooth erupts, which means that the ability to make enamel is forever lost once eruption occurs. The dental papilla is a fusion of ectomesenchymal cells termed odontoblasts, which forms the dentine, the yellow substance that forms the bulk of the teeth. Dentine consists of calcium, phosphorus, and hydroxyapatite crystals bound together in a hard crystalline substance. The dental follicle gives rise to three major cells: cementoblasts, osteoblasts, and fibroblasts. Cementoblasts forms the cementum, that is a calcified material covering the teeth roots. Osteoblasts gives rise to the alveolar bone around the roots of the teeth, and fibroblasts develops the periodontal ligaments, which connects the teeth to the alveolar bone through the cementum. Two main sets of dentition exist: a primary dentition, referred to as baby teeth, and an adult or permanent dentition. Under normal physiological conditions, a human will have 20 deciduous or baby teeth and 32 adult or permanent teeth. The process of tooth development begins with the tissues of the first pharyngeal arch. It is a complex process resulting from interactions between the oral cavity ectoderm, which gives rise to the cells that produce the enamel. The neural crest ectomesenchyme gives rise to the tooth structures other than the enamel. Primary dentition begins to form in utero at 20 weeks of gestation. If they do not start to develop at or near these times, they will not develop at all. Eruption of primary teeth into the mouth begins between the age of 6 months and 2 years. Typically, the bottom two front teeth, central incisors, are the first teeth to erupt. All primary teeth should have erupted by the time the child is 3 years of age. At approximately 6 years of age, the first permanent tooth erupts, typically the central incisors. Except for the third molars, the wisdom tooth, the process finishes around the age of 13 years. The third molars typically erupt around the ages 17 to 25 years. However, in some cases, it may never erupt due to the absence of development or remain impacted in the jaw. The nerves that provide the sensations of pain, touch, and temperature changes to the teeth are by the branches of cranial nerves number 5, the trigeminal nerve. The second main branch of cranial nerve number 5 is the maxillary nerve, which innervates the upper row of the teeth with smaller branches, the superior alveolar nerves. The third branch of cranial nerve number 5 is the mandibular nerve, which innervates the bottom row of the teeth. Both rows of the teeth are supplied by small branches of the maxillary artery, a branch of the external carotid artery. The maxillary arch is supplied by a plexus of 3 arterial branches, which include the anterior superior alveolar artery, the middle superior alveolar artery, and the posterior superior alveolar artery. The anterior superior alveolar artery arises from the infraorbital artery, a branch of the maxillary artery, to supply the anterior maxillary teeth and gums. The inferior alveolar artery, another branch of the maxillary artery, supplies the mandible. Thank you for watching this video till the end. Hope it was more helpful for the students. There is a second part to this video as well. It will be covering more of the function and the mechanism of the teeth. So stay tuned for that video coming up in the next episode. Thank you.